When Chiefs quarterback Patrick Mahomes lay on the ground with the medical staff examining his knee, it left NFL fans in stunned silence, wondering what would come next. Well, they didn't have to wait long, because roughly 24 hours later, Mahomes was already in Dallas undergoing surgery with Dr. Dan Cooper, the Cowboys' head team physician. For a closer look, we go inside the blue tent. So we're looking at the backside of the skeleton here. We're starting up around the pelvis, which anchors to the spine. Then we've got the thigh bone, the femur, the two lower leg bones, and the foot and ankle. And we're going to raise the skeleton up so we can focus in on the left knee, which is what Patrick Mahomes injured. And we're looking at some connective tissues around the knee joint. We're just going to remove some of them out of the way so we can get a better look at the ligaments that were actually involved in his injury. And right now, what you're looking at here, this is the PCL, part of the two cruciate ligaments that cross inside the knee joint. We're going to remove the PCL so you can get a look at the ACL, and we're going to highlight it so that you can get a more distinct picture of it. And the ACL runs on a diagonal inside the knee joint. That helps control deceleration and rotation. So when you're planting and changing direction, it's the ACL that has the final call on stability. If we come to the outside of the knee, we can look at the fibular collateral or lateral collateral ligament, as it's more commonly called. Fibular collateral because it does attach to the fibula there. This helps control the knee in side-to-side direction, especially when moving towards the outside. Now, these are the two ligaments that were reconstructed and repaired in Mahomes' case. And if we put all of the other soft tissues back into their place, we're going to leave those highlighted so you can see them. And we're going to add the muscles back over the top because the muscles then have to be retrained once the ligaments start to heal. So looking at the skeleton now, you can see the ligaments are deep to all the muscles, but you have your hamstrings on the back of the thigh, the calf muscles on the back of the leg, even the glutes up high. Those will be important for controlling strength on the backside of the knee, and we'll rotate the skeleton around to the front. So you can see the big muscle on the front of the thigh, the quadriceps, exceptionally important when you're talking about ACL reconstruction. And also at the base of the front of that thigh muscle, you have this tendon. This is what anchors the quad to the shin bone. And right here is the most common area that is used to make the graft that forms the ACL. So imagine the surgeon has to take that graft, shape it, put it inside the knee in the exact orientation of the original ACL so it can go back to its proper function. In the early days, Mahomes will focus on range of motion, quad strengthening, and learning how to walk normally again. The weeks and months that follow will require patience and determination as he retrains the strength and coordination of his left lower extremity. After all, one of Mahomes' hallmarks is his agility, both inside and outside the pocket, that seemingly magical escapability, and that may take the longest to recover. We can't say definitively when he'll return to NFL action, but we can say this. Recovery from this type of procedure typically takes 9 months to a year, with a return to pre-injury level of performance, often extending even further. So, stay tuned.